Good morning. I will be going over the use of an Össur cold rush machine. You will be having surgery with Dr. Hughes. I will start with the shoulder cuff. So Dr. Hughes has you renting or purchasing an Össur cooler. You will be purchasing the cuff portion. This is yours to keep. No need to bring it back. You will also require a 11 by 15 inch gel ice pack. This comes into play after you have returned the rental machine, and that also is yours to keep. You will need an extra soft exercise ball. I will show you some exercises you'll be doing with that later on. You will also need a long sleeve button-up shirt with a collar, and you will need to bring that with you to your surgical date. You will wake up with all of this on, and you will require that shirt. They will not put this on you unless you have it, so that's very important. You will also require, if you live out of town, to have a 12-volt adapter for your car. When you leave the hospital, you'll be required to use the machine in your vehicle from discharge to home. So that being said, if you live more than a half hour from Kamloops, you will be required to either have that in your vehicle or rent one. We do also have those for rent. And the other thing he requires is that you have a recliner at home. That's best case scenario. If you do not have a recliner, pillows, we can make a elevated position for you in a bed or on a couch. Best case scenario is a recliner. So you will be wearing this system for 4 days straight, day and night. This machine does have a temperature dial. When the actual knob is down, the white arrow is down, it is off. When you turn the dial, you'll hear a click. The click does turn the machine on. The temperature dial goes from 1 to 5, but you only want to wear this machine at 1 during sleeping hours and 3 during the day. Do not go colder than that. And so you can wear it from during waking hours, and then on day 5, you're going to stop using it at night and just wear it during the day for 2 hours on and 3 hours off. No longer needed at night. And you'll be wearing it that way for 3 weeks, which is approximately your follow-up appointment. At that time, if you have rented this machine, you need to bring it back to Pratt's Pharmacy. When you look inside the cooler, it has a stripe up the side of the cooler. You can see where it is blue at the bottom and yellow to the top. You fill it to the top of the blue line with water and then the rest with ice. So your best case scenario is to find a container that is a similar size as the actual cooler. Some suggestions are Tupperware containers, the flat ones. You could also wash out yogurt containers really well. Freeze those up ahead of time. You can then put the water in the cooler along with the ice, and then you'll be ready to go. The bigger the blocks of ice, the longer this will last. One thing you need to keep a close eye on with this machine is that there is a risk of being allergic to ice in your body. What that would look like is you would have a rash the same shape as the actual cuff. So if you see any of those types of reactions, make sure you give the surgeon's office a call. They'll instruct you what to do. These machines are pretty much bulletproof, but if you do have any issues with the machine, you will find all the troubleshooting in a pamphlet we will give you. The biggest issue usually is that the machine is actually unplugged from the tubing and the cuff before the machine is turned off. So make sure that you turn the machine off. So turning off, just click the button downward before you detach the cuff. Because what will happen is an airlock will happen in the tubing, very hard to get rid of. So make sure you do that. You turn the machine off before detaching your cuff. So post-operative care, when you leave the hospital, you are going to have a dressing on your incision. You're going to have your flannel button-up shirt. You're going to have a sling, and you're going to have your cold rush pad on. Dr. Hughes' team will give you a package that will include a prescription for physio rehab and 2 prescriptions for pain. You'll want to keep that physio rehab prescription for a later date when you will start physio, which usually happens about the 3-week mark post-surgery. The 2 prescriptions, you can have a family member take them and fill them while you're in recovery. They then can come pick you up and head straight home. The day after surgery, you actually will start using this exercise ball. What's important is if you immobilize your arm in a sling, you often get very swollen fingers. This is normal, but this ball can help alleviate those swollen, I call it Mickey Mouse fingers. You literally just put the ball in your hand and start squeezing it. You can rotate the wrist, and that will just engage the muscles all in this area and help move that fluid around. If you have a recliner at home, which we highly suggest, you're going to be spending the first 4 days and nights after surgery in the recliner. When you recline back, it puts the pressure on the middle of your back, not on your shoulders. It also keeps you in a very confined space, which ensures that you have 4 solid days of healing. On day 5, post-surgery, you can go back to your bed, but don't be surprised if you end up back in the recliner. This is quite normal. Use your body, judge the pain, stay where you're most comfortable. On day 5, you can actually take the dressing off your incision and you can leave it off. Take a look at the surgical site, make sure there's no signs of infection. So if you see any redness, oozing, or it feels warm to the touch, any change in the incision, make sure you call Dr. Hughes. It talks about switching from a long sleeve shirt to a tank top. We are headed into summer. If you are icing or using this cooler, make sure you have your long sleeve on. If you are not, and if you're in between icing and you feel it's too warm, you can put a tank top on. But what you can't do is move your arm away from your body, above your head, or outward from your body. So whatever you do put on, it has to be fed on your arm or on your body. So just be wary of that. This is very hard to put on by yourself. So if you take it off, ensure you have someone to help you put it back on, because with one arm, you cannot put it back on. And here's the clincher. You cannot get the surgical site wet for 10 days. So if you have a detachable shower head, you can shower from the chest down on day 5, but do not get your surgical site wet. The sutures will dissolve and that will not be good. When you leave the hospital, like I said, you will get 2 prescriptions for pain. One will be a narcotic, one will be Tramacet. I'm going to give you some information, and you'll also get this information from Dr. Hughes. The pharmacist where you get your prescriptions will go over all of these medications. If you have any further questions regarding those, either contact Dr. Hughes or the pharmacist. They are a wealth of knowledge. Physio rehab usually starts at about the 3 to 4 week mark post-surgery. When you get home and get settled, give a physiotherapist a call and pre-book an appointment with that physiotherapist. When you go to your first appointment, bring the physio rehab protocol prescription to the physiotherapist, and they will know which exercises to perform with you. Also ensure that when you go to your first couple of sessions that you have some pain control, have taken pain control before your appointment. They usually do put you through quite the pace of exercises. When you get home, this is where that ice pack comes into play. You can use the ice pack, or if you've purchased this item, you can use it then. They want you to ice for about 2 hours post physiotherapy. Again, not on bare skin. Make sure you have something covering your skin. Follow-up with Dr. Hughes usually occurs at approximately the 3-week mark. At that point, he will check your wound, check your pain control, have a discussion about physiotherapy. He then sees you at about 3 to 4 months, checks your range of motion. He does a physiotherapy review and a return to work discussion, and then also does a follow-up at about 1 year, only if needed. Some of the other stipulations he has is no driving post-surgery, so usually no driving before your 3-week follow-up. They often will ask you to get a BD Easy scrub. That's a scrub they use to decolonize the skin pre-surgically. We do have those. Every protocol is different, so just know that we do have those if you need them. If you have rented this machine, please ensure that you've cleaned it thoroughly before you bring it back to us. We do have a cleaning charge if it is not clean. If there's anything in this video that contradicts something Dr. Hughes has told you, please follow his instructions. Every surgery is different. This is mostly just an overview of the use of the machine. I'm going to go over some exercises that you're going to possibly do post shoulder surgery. So what you want to do on day 2, 3, and 4 post-surgery, you want to take your sling off your arm, hold your arm close to your body, do not let your arm hang, but what you can do is put the ball in your hand and just do some gentle arm curls supported by the arm of your recliner. What this does is it further engages the muscles in your arms and gets the fluid moving so you don't have any swelling or less swelling than you would being immobilized by a sling. So like I said, do the arm curls for approximately a minute. You can do it several times throughout the day. Most importantly, do not let the arm hang. Once you're done, you can put your sling back on and plug yourself into the cooler. And that will just take any inflammation out of the arm that was created. On day 5, you can actually lay flat on the couch or in your bed. And you can do gentle arm curls right from flat against the body. You can do that for approximately 2 minutes with a 3-minute rest. And you can do that several times throughout the day. Once you're done those exercises, please put this back on and let it run for between 1 and 2 hours just to take any inflammation out. We will now go on to the application of the cuff. Okay, I'm going to go over the application of the shoulder cuff. Shoulder cuff comes with 3 separate pieces of Velcro. There is a long, a medium, and a short. The Velcro on these pieces is very aggressive, so I always warn people certain fabrics will be ruined by this Velcro, so just be very cautious if you have certain fabrics with this Velcro. So the application with the cuff starts with, so the cuff itself goes on the patient. It goes equilaterally front and back. You want to have a nice long sleeve flannel button-up shirt with a collar. So I'm just going to get you to hold that for me. And the first Velcro piece that goes on is the long piece. It is the anchor. It's what keeps the actual keeps the cuff on. So it goes across the body, under the opposite arm, and anchors it on the back of the patient. So boom, it's on now. So you then can move to the medium Velcro. This is your underarm anchor. So it starts here, goes under the patient's arm, and anchors at the back. Okay, so there's your further anchor. The last piece is for your bicep. So it starts at the front. As you can see, the Velcro is very aggressive. So it starts at the front, goes around the arm, Velcro's at the back. So as you can see, when you look at the hose that leads from the cuff, you want to ensure that you never have the cuff bent like this. What this will cause is it often will burn out the motor in the cooler. So you want to have a nice long line down the body. So when you're attaching the cooler to the cuff, you want to ensure that the cooler is on the floor or something beside you that prevents the movement that would kink the cooler. So I'm going to show you, it's a simple attachment to the actual cooler. So you can see how the valves are here and the ends are here. It literally is just a click and a click, you're in. So you're attached at this point. Once you are completely attached and you are full of water and ice, you then can turn the machine on with the dial. What you don't want to do is ever detach these two pieces before turning off the machine. So if you have the machine off and you want to detach the machine and say head off to the washroom, there's two silver tabs on the actual cooler side of the machine. You simply push down on the silver tab on each side and both pieces just pull apart. What you want to watch for is there always is residual water in both of these ends. So if you have a hardwood floor or leather seating, you want to make sure you have something to dab those with. Once you're all dabbed, you can head off to whatever destination you are needing to go. And once again, once you have this cuff on, best case scenario is to leave it on. It's very lightweight. If you don't have somebody to help you put it back on, it's best to just leave it on and not have to worry about trying to get it back on the next time you need to use it. When you leave the hospital, you will have this on. So if you have any questions about how it goes on, that will be your best example. The nurses are very good at putting that on in the OR. So you take some pictures is what I usually give most people, that information. So that's about it for the shoulder.